I'm Claire. I am a member of the CPD Officers Network and also the CPD Officer for the Irish Nutrition and Dietetic Institute. So I'm going to give you part one of a series of 3 presentations this morning around how to effectively plan and engage in CPD. So that by the end of the 3 sessions you should have a fairly comprehensive and in-depth overview of how to go about CPD. We can take questions at the end. Catherine will present after myself and then Sinead, and then we'd be happy to take questions, okay? I'm just going to run through very briefly what CPD is all about, the steps involved in the process. According to Carew, there are 4 steps, and they're fairly straightforward steps: reviewing and planning, which I'll cover, the implementation, the going, the way of doing, and then the demonstrating, which Catherine will get into the detail of. So I will just go over how to review your learning needs, where to start, why it's important, and how to plan effectively. And then we'll look at some key elements of reflective practice, which is really at the heart of CPD, and it's at all stages of CPD. And how to record and evidence your CPD. Because at the end of the day, you're probably engaging in work-based CPD activities on an ongoing basis. But unless you have it evidenced and recorded, it doesn't happen from the point of view of audit at the end of the day. So we'll look at some key facts there. So just first of all, what is CPD? What do we mean by CPD? I suppose we all really know what it entails. Carew's definition is the means by which health and social care professionals maintain and improve their knowledge, skills and competence and develop the professional qualities required throughout their professional lives. So it's really any activity where an individual learns new skills or knowledge. The emphasis is on new skills or knowledge, although maintenance of skills is also important. And relevance, and that's a word you're going to hear me saying quite a bit actually in this presentation, trying to get across the point that it really has to be relevant to your day job. I think sometimes when we're asked about what our learning needs are, what our training needs are, we sometimes think of all the areas and topics that we don't know about and all the sort of nice to know areas sometimes. And it's really important to focus back on what you really need to rise to the challenges in your day-to-day job. Because we do hear that, a lot of service users are now coming in with more complex issues perhaps than previously, perhaps than 5 or 10 years ago. So we're constantly needing to upskill in order to maintain the pace. New learning and skill maintenance, so the emphasis there is on new learning and enhancement of practice, which is really, really key. There's not much point in attending meetings, conferences, engaging in CPD and so on, unless it's applied to practice and unless you actually take the learnings and actually do something with it. So enhancing practice is absolutely vital at the end of the day and being able to demonstrate that. So the benefits are fairly self-explanatory in terms of you as an individual practitioner. It'll promote lifelong learning and that attitude of constantly developing, constantly moving forward. I think a really important one for the individual practitioner is this one about improving confidence. Because, particularly in the sort of health service that we work in, where there are challenges, it can, confidence can sometimes take a hit, take a knock. Enhancing career opportunities, obviously, it's an important factor, and providing structure and support to meet your professional goals as you go through your career. From the organisation's point of view, it's about having high quality, evidence-based practice going on day to day and developing an accountable and flexible and skilled workforce. Hugely important, improving staff morale and motivation, and also on an individual basis, that's very important to be motivated, and quality assurance. From the service user's point of view, we're ensuring that all our service users receive a high quality service that they deserve, and as health professionals being in this job, that's obviously going to be very important to us, that we want to see the best outcomes possible for our service users. And that is important too from our professionals' point of view, in that, good outcomes, positive outcomes, can prove your value, prove the worth of your interventions as well, where it's relevant. And increasing confidence in the health service from the service user's point of view is very important. And then, obviously from our professional point of view, it enhances the status of whatever profession you belong to. Promoting research and evidence-based practice also, brings visibility to your profession, and it provides stakeholders with evidence that the professions are committed to delivering high-quality service. Just in general terms, Catherine and Sinead will touch on some more of the regulatory aspects in terms of CPD requirements, but just to be mindful of the fact that it should be an ongoing process. There is really no beginning and no end, even though there are stages to the CPD cycle. Just in terms of CARU's requirements, we know that it's a minimum of 60 credits or 60 hours of CPD in a 24-month cycle. You may be engaging in a 12-month cycle, but as long as you're meeting these minimum requirements for CARU, that's okay. What's really important is that there is a broad balance, a broad range of learning activities that you engage in. That it's not all just formal CPD or work-based CPD, but that you recognise there are 4 categories of CPD from which you can get a huge amount of learning. Work-based, professional and self-directed. And that whatever type of CPD you engage in, it must be high quality, up to date and relevant. Again, that word relevant to your day-to-day practice. So formal CPD activities, I don't think any of us have any difficulty in recognising where we're getting learning from. A day like today, for example, whether we engage in further education, whether it's diplomas or master's degrees, relevant conferences, study days, and some of you within your professions may have special interest groups that do study days and training days, and obviously they all constitute an important part of CPD. There could be mandatory health and safety training, CPR, fire safety, that kind of thing. But it's the informal activities. This is just the tip of the iceberg when it comes to informal activities. It could be things like sitting on committees or on councils in your professional body or on external committees, volunteering, reading journal articles and current research, which you'll be looking at in the workshops later on. You may undertake research or audit, be involved in presenting, producing posters and abstracts, journal clubs, personal learning journals, and so much more on a daily basis. Team meetings, multidisciplinary meetings, they're a great opportunity for learning. You may be discussing complex cases, and sometimes learning arises fairly spontaneously day to day. And it's actually, the trick there is capturing that and recording that, which Sinead will talk about. Supervising students, mentoring. You may be giving presentations, giving talks to colleagues or outside of where you work. And all of these constitute learning opportunities. So, the key message is don't just focus on formal CPD. It's so much more than that. The CPD cycle consists of 4 fairly simple but integrated steps. I'll cover the reviewing and planning. Then there's the going away and doing, the implementing, and then the demonstrating, which is the recording and evidencing. But at the heart of that, and underpinning all of it, from review right through, is reflection. And reflective practice is so important. We can't even assess our own learning needs without a great deal of reflection. So that is what really holds everything together in the CPD cycle. A review of your learning needs is really a self-directed or a self-assessed review of the knowledge, the skills, the personal qualities and attributes that you need to develop a personal learning plan and a plan of action. You have to, though, make sure that your personal goals do align with the needs of your employer, with your organisation and with your profession as a whole, and of course with the needs of your service users. And for those of you, I don't know if any of you here may be self-employed, obviously then it would be in line with the needs of your service users. And it is about, after you've done the review stage, highlighting where the gaps are and actually then implementing a plan of action. So I often say to people, to start off with, if you haven't already, investing time in yourself, self-reflecting. This review stage it can be so empowering and so motivating, and particularly when you're working perhaps with challenges, with changes maybe in your job description that are occurring at sort of a fairly regular basis. It's really good to take time out and reflect on the positives first, your achievements, your expertise, before you go on to analyse, where your strengths are and maybe where you're not feeling so strong or where you need to gain more CPD. And to be mindful of the challenges that you face. And at the end of the day, to say that it is all about having the confidence at the end of the day to meet those challenges very effectively. And it is about becoming a better practitioner and doing the best job that you can do. And it may be helpful to think about where you are in terms of your career. Are you happy where you are? Do you want to move forward? And where do you want to be? So all of these things come into play when you begin. The tools and the things that you need to start, really your CV is a good starting point. So, maybe, brushing the dust off some of the CVs. We tend to think of CVs sometimes when we're applying for a new role or a new post, but sometimes updating your CV, using that as a starting point, can actually trigger, all of the things that you may have achieved in the last few months that you had maybe just put out of your head. Things like contributing to practice guidelines, contributing on committees, maybe you've been engaged in a project around student supervision, and it just is a good starting point. You'll need your current job description and the objectives of your role. You'll need to have a look at those, the main duties and responsibilities that you have, because as Catherine will say later, when you're developing your portfolio, you need to be able to put your role into context for Carew and for audit purposes. So you'll have to talk about your practice setting and that kind of thing. When you're looking at your job description and the objectives, it can be worth doing. I don't know if some of you have heard of this plus and delta kind of exercise, where you look at what am I doing well when I look at my duties and responsibilities, and what could I do differently. And if you're going to have a performance review, if you've a line manager to have a performance review with, it's good to do that exercise before engaging in the performance review. Sometimes when you get to that level, it does throw up the fact that you've had a lot of extra or additional responsibilities that may not have been reflected in your original job description. So it's a very good exercise to sort of just bring you up to date and see where you are. It's good to refer to relevant documents and strategies that can help you, again, put your role into context. So you may have, a lot of professions will have competency documents, and there are competency documents for managers as well, which is good to include in that review. You may have strategic, organisational, departmental plans or strategies that are relevant to your role, things like Healthy Ireland, Children First, the national strategies and any research reports that have been published that are relevant to your practice setting. There are plenty of planning tools and templates also available on HSE Land, or you can contact your professional body or your CPD officer in order to access tools that just help you in the planning stage. Always be mindful of your current and your future roles. So, it's kind of keeping one eye on the future and being a step ahead all the time. You may find it useful to consider your professional development and your learning needs under these headings: knowledge and skills, personal effectiveness skills, leadership and management. And then consider the resources and the support that you need to achieve your goals. So perhaps if you have identified the need for some formal CPD, attending training days or conferences, you will need the support of your line manager. But there may be other ways in which you can access CPD that will actually do the job very well. There are a lot of, again, excellent resources on HSC Land in terms of personal effectiveness, how to manage groups if you're sitting on a committee for the first time and you're developing in that professional area, how to chair, how to lead. It's so much more than just your own expertise and your own area of practice. So once you've reviewed, what you'll have then in the outcome is you will have a list, hopefully, of learning needs, the skills, knowledge, attributes that I need to gain or improve on. I have a start, but I need to enhance even more. And it's from those learning needs that you choose the most appropriate learning activity. Or indeed, you may need more than one activity to address the learning need. So you may find that you need to attend a workshop to gain some skills, but also you may back that up with some self-directed reading around the topic. So the learning needs will determine the most appropriate CPD activities. And at this stage, if it's appropriate, you may need to obviously work through that with the manager. You'll also need to be mindful of learning outcomes, which are slightly different to learning needs. What will I get from the CPD activity that I decide I need to engage in? What do I want? What do I need to know when I've completed a learning activity for each learning need? And I'll just show you a sample of one thing over the page. You'll need to prioritise those learning needs and those CPD activities. It may not be possible within, say, a 12-month framework to complete on everything, and it may not be necessary. So you can decide what are your short-term goals and what are your longer-term goals, and set the timeline. It's important to remember, despite all the reviewing and planning and self-reflection, not all learning is planned, particularly a lot of the learning that you'll come across day to day. So if you are in a crisis situation, or sometimes you have a problem that needs solving, that can be a huge learning experience. So it is worthwhile remembering to record these unplanned activities and add them to your portfolio. So just a word about setting priorities and timelines. Just be mindful of the SMART goals, which I'm sure you apply in practice with your service users sometimes, but also in terms of your own personal goals. Don't set yourself up for failure. Don't take on, too much in one go. But as long as you are also in line with careers requirements and that you're going to get enough CPD as well. So this is just a sample learning plan. It's just one learning need. This is how you would lay it out. This is a Karoo template, and you'd have to be sure that any professional templates you use for personal learning plans do comply with Karoo. So the learning need there is, I want to enhance my understanding of the person-centred approach and application of behavioural change skills. The desired learning outcome at the end of my activity, I want to be able to more effectively support my service users to implement lifestyle changes for the management of type 2 diabetes, for example, where I work. And what I'll do is I will attend motivational and interviewing workshop level 2. I've already got some foundation skills, I really need to enhance them. And I have checked the calendar, and I have decided with my manager that within 6 months I have an opportunity to engage in this course, and I have the release to do so. So that's just a sample of one learning need. So once you have your learning needs identified, really it's up to you then to go put your personal learning plan into action, do the implementing. And just to be mindful again that CPD is something that you engage in on an ongoing basis and regularly add to your portfolio, particularly reflections. You may identify new learning needs as you go, you may do a review at the beginning of the year, but then as you go, as your job description changes, perhaps a comment comes up, changes happen, and you may need to identify new learning needs as you go and add them to your portfolio, and that's fine. And include reflections as evidence for any unplanned learning experiences, which Sinead will talk about. And then just bringing it all the way through back to review at the end of the cycle. What was achieved, what wasn't, and why. Sometimes you can choose an activity that you're hoping will meet a learning need. You may go to that event and actually find it doesn't really deliver what you were hoping, and that you don't get the learning outcomes you need. You may need to look at that again. Or it may be that the time frame was wrong and that it was too short a time frame. So always then for the next round, the next cycle, address the unmet needs. What further action do you need to take to address those? So I'm going to end here, and I'm going to hand over to Sinead, and Sinead is going to talk about the reflection piece that underpins together, and we'll take questions at the end. Thank you.